In today's discussion, we will learn about osteosarcoma, also known as osteogenic sarcoma. What is osteosarcoma? It is a malignant bone tumor arising from the primitive bone forming cells. It begins in the metaphysis. What are the common sites of osteosarcoma? The common sites of osteosarcoma are lower end of the femur, upper end of the tibia, and upper end of the humerus. What is the age at onset? Age at onset is usually we do the clinical classification, that is acute and chronic. Acute usually occurs in between 10 to 25 years of age, which is usually common, and chronic, which occurs in later life, which arises as a complication of Paget's disease known as osteitis deformans. Then the pathogenesis. Pathogenesis is first of all genetic mutations. Here RB gene mutation occur in 60 to 70% of the tumors. The tumor begins from the primitive bone forming cells in the metaphysis. The bone structure is destroyed and it invades into the surrounding soft tissue, causing the elevation of the periosteum, and there is subsequent new bone formation under the raised periosteum, that is known as Codman's triangle. Then the tumor takes less time to metastasize through blood, and it mainly metastasizes through blood to reach into the lungs to cause any pulmonary complications. Classification. We have learned about the clinical classification. Now the histological classification. That is, we have 4 types: osteoblastic, chondroid, fibroblastic, and telangiectatic. Osteoblastic is grayish white, hard, and has a gritty feeling when cut. Chondroid is bluish gray and opalescent. Then there is fibroblastic, and another one is telangiectatic, in which there is necrosis, and we can see a few areas of blood in it. Clinical features 2. Symptoms and sign. Symptoms are pain and a gradual increased swelling around the knee and the upper arm, fever and weight loss. In sign, we look at the site, then we try to feel the size, shape, consistency, overlying skin, which may be warm, and there may be engorged veins may be present. Then the margin, which is irregular as in most cancers. Then movement, there is restricted movement of the affected joint. Then we look at the inguinal and the popliteal lymph nodes, which can be enlarged, and we try to assess the popliteal pulse. Investigation. Investigation is, first we do a plain radiograph in which there is irregular osteolytic lesions of the metaphysis. The periosteum is raised. Then evidence of a new bone formation under the raised periosteum is seen, that is known as a Codman's triangle, and sun ray appearance is seen, which are well marked radiating spicules. Here new bone is laid down along the blood vessels within the tumor, which grow centrifugally. Now we will look at the X-ray. In the X-ray we can see irregular osteolytic lesions, then we can see a raised periosteum, then we can see Codman's triangle and sun ray appearance. This is the typical X-ray picture. Then the other investigations we can do is biopsy, that is incisional biopsy and core needle biopsy. MRI to check if there is metastasis to any other soft tissue. Chest X-ray to check for any pulmonary metastasis, as we have said earlier that it can metastasize rapidly through blood. And a high resolution CT is done. Treatment. Treatment is neoadjuvant chemotherapy, that is chemotherapy which is followed by surgery. It reduces the size of the tumor. Then in which time do we give? We give it in 3 cycles, in 3 weeks interval and 3 weeks prior to surgery. The surgery we do is limb salvage surgery, and chemotherapy for 6 months is continued. Then the reconstructive procedures in limb salvage are resection arthrodesis and reconstruction with massive allograft or megaprosthesis. Thank you.